Hello again. Welcome to this Unoverwhelmed Emotional Fitness channel. We are here to help you. This is a channel where you're going to find resources in a holistic approach, especially when you're a parent, and most importantly, when you're a parent with a child with disabilities, even more so for a child with autism. So we are always here very mindful of trying to bring the specialized opinions and, of course, knowledge of very generous doctors that are giving their time to help us today. And today we have none other than Dr. Nalini Gupta. She is a highly regarded specialist. She is the assistant professor in the Department of Speech and Hearing Services. She's a clinical director on Autism and Neurodevelopmental Disorders Program of Excellence at the Elson S. Floyd College of Medicine in the Washington State University. Spent especially the last 2 decades working with children with autism and different neurodevelopmental disorders. So she works with congenital anomalies, genetic metabolic disorders, developmental delays, and of course, very complex psychiatric conditions. She is very well recognized in the field, but I very much like how she says that she sees herself as an educator, aiming to empower both the patients and their families, as well as meaningful contribute to the education of future physicians in clinical settings. She's a very important advocate of the holistic approach. So her curriculum is very long, very interesting, and we're going to have it in our page, which is Unoverwhelmed Emotional Fitness. And she's very wide known for her practice. So today we are going to talk about visiting the doctor. But it's not just a visit. Once we start noticing that something is wrong with our child, even before the diagnosis, the first thing we need to do is understand that we have to go visit several doctors. Today, we're going to talk about what to do before the visit, during the visit, and after the visit. Very prompt, concrete tips on what we should be doing. Believe me, if I had known this, I would not have made so many mistakes that I did. But most importantly, she talks about how we should validate our emotions as we're visiting the doctors, how we should also be advocates, not only for the child, but for the family as a whole. So with her experience, she always takes this holistic approach of seeing the family, not just the child. So I want to invite you to listen, please. Pay attention, hear the whole interview because it gets better and better as it goes through. And she's just a wonderful doctor who really cares, and that's what we're looking for. So if you know of a doctor that may benefit for this, please share it. If you know of a family that would benefit from this, also please share it. And remember, subscribe to the channel, give a like, and please listen. You're going to learn things that you might thought it was obvious, but in reality, they're going to say like, what? I should have thought of that before. So welcome, and let's take a listen. Hello, doctor. How are you? Thank you, Dr. Nalini, for being with us today. I'm so excited, so very happy, and I cannot thank you enough. I can thank you so much. When you accepted this interview, I remember the first time when we went to visit you, how, of course, even though my son was relatively older, he was still with many issues, and how just walking into your office made me feel better. It made me feel at ease. It's like, oh, it's okay. I understand you just by the way you looked at me. And I want to thank you for that. I really want to thank you on my behalf, and most likely on the behalf of all the other very concerned parents that go through your office. So Thank you for accepting being here today. Would you please tell us a little bit about your background, what your whole name means and all that, please?
Yes. So first of all, thank you, Elvia, for your kind words, and I appreciate it as well. It is my pleasure to be speaking with you today about how to help families who have children with autism or other neurodevelopmental disabilities. About myself, I have been practicing pediatrics for around 30 years now. I am going to be retiring soon. I trained in India. I did post-graduation in pediatrics in India, and then I did my pediatrics residency here. So it's almost like doing the training twice over.
Wow.
It was a long road. I got interested in developmental pediatrics early on because I have a very close friend's daughter who has autism. And that's what got me into neurodevelopmental challenges that children may have. After that, I went on to learn about neurodevelopmental challenges with another physician. I was living in Atlanta at that time, and I trained under him for 6 months at their children's multidisciplinary neurodevelopmental clinic. And that's where I got most of my training in this subject. Since then, I've been practicing and taking care of healthy children and children with neurodevelopmental disorders.
Right.
That's in a nutshell.
Yes, in a very small nutshell, because we're only talking about 30 years. I very much how you say that you view your role as an educator and aiming to help the parents, because yes, often even though the patient is a child, we are the ones who have to know how to best help them. And all the while, we just have so many questions. So today, I would like us to focus on how to best prepare and make the most of the visit with our doctor, because not that we don't want to be prepared, sometimes we don't know how to prepare. And we don't know how, it's not like a regular child, if neurotypical, taken into the doctors, even though there's always surprises. But with our children, there are more challenges and difficult parts. So if for those parents who would like to be prepared to go into the office, we would like to talk today about those situations, how to best. So we're going to divide it before, during, and after. So what can we do before the visit? And what can we do during the visit and then after the visit? So,
Perfect.
like I said, just walking into your office was already easy, but it's not the case in many other situations. So, for the preparation, so can you tell us how we can prepare beforehand and for the visit, please?
So the way I look at it, Elvia, is that the more we do beforehand, the easier our during the visit and after the visit will be. It is good to be proactive. As a parent, your child better than anybody, even a doctor that they have seen for many years. You are the expert in your child, and we have to use that expertise in the way to advocate for our child because they have special needs. So I will tell parents that if your child is anxious about medical visits and it's a new office that you're going to, they have never been to that office before, call ahead and let the staff know that I have a child with special needs who gets very anxious. Is it okay if we swing by and just tour the office with their office manager at a time when there's not a whole lot of people there? And they will be happy to accommodate that. That way you can walk through the hall, know which room the child is going to go to, and take your child with you and say, look, we are just going for a field trip. We are going to see the office, where we park, what the entrance looks like, walk to which room it will be, and ask them to walk you through what the visit will look like. And walk almost like what we do for when we are buying homes, right? We look at the home, we see where everything is. We picture ourselves in that house and where our stuff will go. That is how the child, you can work with the child to say, hey, we are going to meet that sweet lady that you saw. And then when we go in, the office is going to be which room? The third room on the left. And you remember the picture in the office? That's the office we are going to be in. And it helps the child feel at ease. It's a familiar place. We have been there under, I call it, in a non-threatening environment without a lot of chaos, without a lot of children and adults present. And they have seen where it is. So they're not walking in wound up and anxious. So it goes a long way to do a facility tour almost if it's a new place for the parents.
That could just help both the parent and the child to be less anxious because it's already a familiar situation.
Yes.
A little more familiar, but yes. And so the offices are willing to accommodate for that. That's wonderful.
You have to ask. Now, some things that we can ask for our children, and if you let them know, the staff and the doctor, they are both thankful for it. What are those things? I know you have a no phone policy in the room, but my child, sometimes when the visit is going long or if they're really upset, they like to watch Miss Rachel, Thomas, whatever it is. Okay, is it okay if I bring my phone in so we can have a good visit? Is it okay if I can bring some snacks in? I know you have a no eating policy in your office. Is it okay if I can bring some snacks in because it'll be after school and it'll help him or her? Can I bring their favorite toys in?
Can I bring what to me?
Their favorite toys.
Oh, yes, definitely.
That's a familiar object for them because it helps them feel less anxious and it also helps to distract.
And that's very important. You say bring us favorite toy because sometimes we assume that in some offices for children, they have toys and a
Right,
play area. But if the child is not used to those toys and they may be destructive at some point, or maybe another child is already using it, we shouldn't just assume that can be used. I recall when I had to see the psychiatrist that I was just getting that diagnosis. So obviously I was just very concerned. He looked at me, he went out and got some toys, but I was the only one in the office, mind you. But once he got some toys, then I was able to connect. Otherwise, either I was looking at the doctor, trying to
right,
pay attention to what he said, or looking at whatever that child was doing. So
right.
yes, that is very important. Thank you. Thank you for that. Okay,
And
so these will bring, should we tell the child what to expect?
yes, so we tell the child what to expect. We first understand how the visit will go. We communicate with the office staff saying, hey, my child does not like bright lights. Is it okay if you dim the lights in the exam room? Or can they bring a headphone in? You can also make requests. They really don't like their ears to be examined or the blood pressure to be done. Now, I know you need to do all these things. Can we do it at the end of the visit? So if they're upset, we can walk out. Usually, the workflow in most offices is that the MA will come and do all the vital signs before the doctor comes in. And now by the time the doctor comes in, the child is already upset because the blood pressure was squeezing their arm or anything like that. So if you already know from past experiences that something may be difficult for your child to handle, ask up front and say, can we please do these things right at the end before we leave? So if they're upset, I can walk out to the car with them.
That is such a cool tip, right? Because yes, they get anxious because they have to take off their clothes and that, wow, yes, ask them to do it at the end. Thank you.
Right.
That's
Mhm.
super cool.
Yeah.
Yes. So what about during the visit? Can you tell us what to do during the visit, please?
So during the visit, everything that we talked about will help you and the child be familiar and be at ease. It is important that before the visit, if there are any records or anything that has been requested of you, that you have provided before the visit so that the doctor has had time to look at it, review it. And we are not doing the review during the visit because it's best that you spend as much time face to face with the doctor addressing your concerns instead of the doctor looking at any records. So you have done all that. You've sent everything they wanted. All of that is taken care of. Now, during the visit, it's important to have very clear idea before you go in. What is your objective from the visit? What do you want? Is it for a diagnosis? Is it some symptoms that you're concerned about? Do you want help with resources? Do you want help with the school accommodations? If you, as a parent, know what you want from the visit, then you, right at the front, you tell the doctor, this is what I'm looking for. What was your intention? What are you going to be focused on during the visit? And it may be that the doctor will listen to everything that you have, and it may be part of a bigger picture in their mind that, yes, we will talk about all this, but let's first see what the diagnosis is before we do it, what's on your list. So it's good that you understand where the doctor's coming from and the doctor understands what you're looking for. Because at the end of it, it's a contractual partnership. It is a true partnership in the sense that both of you, the physician and the parent, need to feel satisfied with the visit, the way it went. And it is good to have our expectations be meeting. So articulate, bring a list, say, this is what I think, this is what I want. Tell me what your process is and what you will be doing. And are we going to address my concerns all today, or will it be in a second visit? So right at the front, you have clear expectations from the visit.
This is going to get controversial, but obviously I have had experiences with so many doctors.
Mhm.
Some are very good with the child,
Mhm.
but kind of rude to the parent. And I remember one of them that at some point I was like, but I knew how good he was. And he did say it. This is like when you go for a baby to be delivered.
Mhm.
They focus on the mother and the child. They don't care about the husband. If he faints, he's there. So I am
Mhm.
sorry, but I understand that this is difficult for you. But
Mhm.
I'm sorry, my patient is the child. Because oftentimes we are just overwhelmed and it would turn it into us because we feel judged that we have done something wrong, that whatever we're doing. So I think that sometimes it's very important also, how should we help the parents understand that the doctors are guiding us, that they're not judging us, and that at some point, so we can ease or an affective filter, that we can just be ready to understand the suggestions and that there's not judgment. Because even though it's emotionally difficult, we need to know that the patient is the child.
And I agree with you that the patient is the child, but if we don't take care of the caregiver of that child, the patient is affected by that. So I think it is, yes, the patient is the child, but the people caring for the child also are a team that need to be engaged and involved in the care of the child. So I will say that if someone, for example, if it's my child, I'm going in and I may have had a terrible day. My kid this has had 5 tantrums on the way to the office. I am frazzled. This is my first visit, and I want to make the best effort and look like a parent who's in charge and who's in control, right? But my experience that day has been just awful. My child had a runny nose or allergy, and they're acting out. And this is the appointment that we got after waiting 8 months. So I'm not going to reschedule. So I show up. We show up, but it is important. It is all about communication. If we are stressed, if we are feeling judged, it's okay to articulate that to the doctor. It's okay to say, I have waited so long. Any other time I would have rescheduled it. I am really stressed because XYZ. Please be patient with me today. Or if you feel like you're being judged or thinking like, oh my God, this person, this doctor that I want to make a good impression on is telling me that all the things I've been doing is wrong, it's okay to say that. I understand that what I may have been doing may not be what you would recommend. I am feeling very vulnerable right now. I'm feeling like judged, and it's not on you, but I'm just letting you know. And that will allow for the doctor to maybe change their approach towards you and or be mindful of how you're receiving the information. And it just takes a minute of our time to take the pause. And it all comes down to mindfulness. If we are open in our communication and it's collaborative, then it won't seem like somebody is telling you what to do versus this is a partnership. I am an equally important member of the team and I need to be able to say what I need.
That is just, I very much like that, because I remember when I first went to say, you looked at me. You actually is like, I see you. Even I didn't have to say much because obviously with your experience, you already intuitively knew where I was. And then you provided, you may want to look at these resources. And this is, you make sure also that I got some from the mail, which were very helpful. So the fact, sometimes the parents just want us, we just want to be validated a little bit that we are facing a challenge. And even though we're there for the child's sake, realizing that if I don't take care of myself and the doctor disregards everything I'm feeling, then it is going to hinder the child's well-being. Thank you so much. So in that respect, there may be necessary to have other people in the room. So is that advisable
I
sometimes?
would
Because I'm
say
just
a big all caps, yes. It is always advisable. And I'll give you an example in a bit. It's recent, about 2 weeks ago. But in our clinic, evaluations run long. But whether they run long or not, you have a child, if you have a child with developmental disability, with special needs, what will happen is that visit will have been scheduled for a longer duration. And children who have developmental difficulties don't do well contained in a room for a long duration. So it is important to bring somebody that you trust, whether it's a friend or a family member, in the room. And that can serve two purposes. One of the purposes is they can be your second set of eyes and ears. So if you feel like you're getting a lot of information and you're not able to keep track of everything, there's another person listening to it and who can fill in the gaps for you. So you feel like, oh, I am not the only person listening to this, somebody else is taking mental notes or keeping track. The second thing is if it's, and bring a person who's comfortable with your child or somebody your child knows and interacts with. They can distract your child. They can keep them busy while you focus on the discussion with the doctor. Sometimes, if I feel that the kid has had enough, they are now wanting more and more attention every 3 seconds. Their behaviors are for attention because they're bored. They are not happy in being where they are. I may even request the other person to take the child out, either for a walk or a drive, or just sit in the car, listen to music, watch something. And that will allow you to focus and be more present for the visit. So having a second person is absolutely helpful. Bringing another child to the visit is absolutely unhelpful. So having a sibling or another kid in the room, because then your attention is diverted. You're more likely to not be present for the child who's the patient, and you and the physician both will be frustrated.
yes, because and then nobody's going to pay attention. And they obviously, as an amateur parent, I remember that I had no idea what was wrong. I just had a CD, and the doctor just looked at me, and he was all over the place. And this is another doctor, different than the one I mentioned. And then he just looked at him, tried to pick him up. Obviously, my son wouldn't let him. So he had the CD and he had looked at it and says, I think I find him. He just handed the prescription. And on the prescription, it said, RxD, autism.
Oh my goodness.
Just like that. And I was like, when he got just, for me, that even though he was right, how would I, he just saw him for less than 10 minutes. And with that, he was ready to give that kind of diagnosis. So even though he was right, and of course I was overwhelmed with everything and the child. So sometimes we get that kind of treatment, which is, yes, the child was, and I got so angry, but it is difficult to receive the diagnosis as it is. And then with that is like, how does he know? So of course, I'm going to deny it. So if I have another child, then that's even going to be worse. So I think if I had had another person in that room with me, maybe that person would have asked the questions that I could not ask because I was in shock.
It can be very overwhelming to receive the diagnosis, even after a long visit. So I can't even imagine how hard it is when it's given under 10 minutes. And
Yes.
like you said, it is a correct diagnosis, but it really does feel like something just hit you.
Right.
And a lot of times I have parents who have read about autism. They have waited a long time. They know it's autism. In their heart, they know it's autism. And they come in, and despite of everything, the diagnosis feels difficult.
Right.
And the diagnosis feels difficult for a number of reasons. It feels difficult because with the diagnosis, we in our head imagine the dreams that we have for our child, what we have been carrying since we conceived the child, since the child was born. We have had a certain image. We are going to play this, and I will take them here, and they are going to have friends, and this is how the birthday parties will be. This is how they will the school and all of that. And somehow with the diagnosis, it feels like I have to erase all that and I have to restart. And that is what feels overwhelming. There's a lot of grief that comes with it.
Yes. I think that maybe on another interview, be very interesting to understand the
Mhm.
diagnosis because it's just so difficult. So it would be wonderful that now we have the MS5 and all that. But in another, I hope I could get you back here to understand the diagnosis, who can actually give it to us, and we can prepare and give more validation to it because it's difficult to receive it, especially
Yes.
when it just like that. So
Yeah.
yes, so coming back to that, so it touches my heart really, because I remember the moment and it's still difficult after
Mhm.
practically 18 years of that. So it still hurts. So then we're talking about the moment when the doctor, connecting with the doctor, making sure that I have the prompt questions. Maybe I prepared my questions beforehand, and so I already have it. So we can have a focus on the actual moment. Maybe I have concerns. It could be about the food, whatever recommendations, or maybe even resources that a doctor can give us. But if I could already have that in advance, then of course, then the doctor is going to be more engaged with me. And so if I have another pair of ears, that would be wonderful. Don't bring another child and have a person with you to help with the child. That's wonderful. So we're done with the visit. Then what do we do? So after the visit, so maybe something that I want to say also about the visit, and it's important to have the another child. Maybe I'm just overwhelmed, but also I think that we have selective listening. You just hear what we want because we don't want the cold truth. So, oh, he just said that he's going to catch up. We just decide what we want to hear. So it's very good to have another set of ears. I just remember that. Not that I did it. So, what about after the visit? What can we do? So I'm overwhelmed and I need to emotionally regulate because I'm just feeling everything. Maybe I feel judged. Maybe I don't know what's going to happen with my son or my child, what's going to be. So, what do you recommend about that with that emotional regulation that you mentioned?
So I'm going to pause and go back to the visit first. So when this emotional dysregulation, this feeling of overwhelm, this feeling of, oh my God, it's all coming at me fast. I was just thrown into this ocean and told to learn swimming.
Right.
This didn't happen after the visit. It started during the visit, the minute the diagnosis was given to you. If we are mindful and if we know that this is becoming, I am hearing my focus, I just heard the word autism and my brain just is hearing things, but it's not making sense. Take a pause. Say, hold on there. This is hard for me. Just saying that to the doctor will make them take a pause and notice. It's okay to say, this is hard for me. I need a minute. It's okay to cry. It's okay to show that you're upset. And it's okay also to recognize that maybe I'm not ready at this time to listen to what you have to say. I just need a few days to process the diagnosis. It's all right to say that. It's all right to say, hey, Dr. Gupta, I really appreciate you seeing my child. I know I came in expecting a diagnosis, but this is really, it's harder than I thought it would. Can I have 5 minutes? Now, most doctors who've been doing it a while, we expect it. We plan to give the parents some time. And even after those 5 minutes, if it's feeling like too much, just ask for it. Just say, hey, I know what you have to say is important. I've had a stressful day, as I told you about. Can we please make a second visit where I don't have my child with me? And we can do it by telehealth, where I can actually focus on what you have to tell me. It's becoming hard for me to listen to everything. It feels like too much. And if we say that, I don't know if there's a doctor in the world who will say no to that.
Where were
Because
you 18 years ago?
it's a learned skill. And what I want to get out through this interview is you as a parent are the most important person in your child's life, not the doctor. So before we can learn to advocate for our children, we have to learn to advocate for ourselves. It's okay to say, this is hard. I will do it in a second visit. And they'll say, oh, sure, I understand. Let me get my assistant. We can figure it out in 10 days. I'll give you a second visit. You go home now. This is the reason. Here is the information. Read this. Now, the child did not develop autism 3 days ago. It's not like an ear infection. They have had autism all this time.
Yes.
Waiting another 2 weeks after the diagnosis is not going to make a big difference.
Most likely they're already in therapies and such.
Yes. And even if we wait for 2 weeks to start therapy, this is a marathon. It's not a sprint. So it's okay to wait till you are ready to get the information, till you are ready to act on it, instead of going home with a folder full of information and feeling numb and unable to process, and now having a task attached to it. So deal with what you're dealing with, ask for it, and then when you're ready, do a telehealth or in person, minus your child, and then focus. What's my list? I am now ready to take action on it. What do I need to do? Tell me now. The doctor will be more engaged. You will be more engaged. You will be more ready to act on it without the overwhelm attached to it.
You're touching very delicate fibers that even though it's been 18 years since I got the actual confirmation of the diagnosis, I got it by email, and I was far away from home. I was in Canada, and that's when I read it. And it is like you said, so it is very important. I think that I'm going to make sure that we share this video, not just with the parents, but hopefully with all the doctors, because they need to know that, just maybe remember, even though they know that the importance of us not going through that turmoil that it is just finding out, because obviously we go visit the doctor, not just for the diagnosis, but every time we're finding new challenges. So it could be the diagnosis that is difficult as it is, but maybe I go because my son is not eating. He's living off pasta and I don't know what I'm going to do. So that's another visit. And again, for me, it's easier, just eat all the pasta you want, but it's not going to help. So every time this happens over and over, because it's a journey. It's a journey. And it's like you said, you had all these expectations. I have a friend who says, I had bought a ticket to Paris and I ended up in Amsterdam. So maybe you thought we were going to the beach and we ended up in the desert. So we just have to find all the beautiful flowers in the desert too, right? So yes. Thank you. So, wow. Let me recompose myself. Dr. Gupta, this is a lot for me. Let me breathe myself because I'm just trying to listen to what parents that are just starting this journey. I'm feeling them. And I'm just hoping that they can really hear what you're saying because it's so very important. Thank you. So then I'm whatever stage we are in the doctor's visit, but then so I go and it's after the visit. So what do we do after the visit?
So after the visit, one of the most important questions you can ask the doctor is, when do I see you back for a follow-up? And if they say, well, I wasn't planning on a follow-up, and you feel like you need a follow-up because you are walking away with too much to do and you need the support, ask for a follow-up. Hey, could I please see you back in 6 months? I am new at this. I would like to just run things by with you to see how things are going. Request a follow-up if one is not offered. Also, clearly articulate why you want to follow up, or if the doctor wants to follow up, what do you need me to do before then? Is there any paperwork you need before then? Is there any school reports you need before the follow-up? Do you need any other questionnaires filled out? What are we going to accomplish at the follow-up? If that is clear in your head, then it'll make the next visit go better for you. And you can always call back and ask these questions, but I don't like to call doctor's offices back because it's a 3-day process.
Yeah. By the time you go through all those numbers,
Yes.
go here, go there, forget it.
So clarify about the follow-up. They will likely give you an after-visit summary, like a piece of paper that says the diagnosis is autism, this is the follow-up that is planned, and a very brief things that will say your vitals were, temperature was this much, blood pressure was this. There won't be any real information in that because it is printed right after the visit. Ask the office staff. Almost all doctors now have electronic medical records, how you can sign on and get into your child's portal. Now, depending on the state you're in, if your child is above the age of 12, parents need authorization by the child to enter the record. 12, 12 or 14, I forget. But so ask them, if you have preteen or a teenager, will I need authorization to get into the medical records? And if yes, you have your child with you, you can have them sign it, or they can waive that authorization saying your child has a disability, then you have access till the age of 21. Otherwise, you won't be able to see your child's medical records. So that's an important thing for you to know as a parent. Will I be able to see the medical chart of my child? For that, I need to be able to get into the portal. Let me create my login and the password. And the reason why I'm saying that is important is medicine is changing. So one is that as soon as the doctor finishes the visit note, and it can take them, based on if it's the initial evaluation or not, it can take them up to 10 days to 2 weeks to finish that note. The minute that note is signed, you will be able to see the entire note. That is the real deal. That is what you need to get your hands on. And that will jog your memory as to all the things that were discussed, and everything that has been recommended will be in that note. So that way you can look at it again and say, well, I don't remember talking about this, or here, these are the things they were talking about. Maybe I didn't remember it exactly. So that is good for you to know and have.
Or I chose to forget it.
So that will be your document where you can reliably look at. Having access to electronic medical record is also important, because now if you need to find out when the follow-up is, you have a little message for the doctor. Hey, you told me to do this. Hey, I read this article and it's freaking me out. What is your opinion on it? You can electronically message the doctor and get their opinion without waiting for a physical visit to discuss these things.
Who answers those messages?
The doctors do. First, the nurses look at it and they will answer basic stuff if they can, but most of the bigger stuff. Now, I will caution, don't send things that need a timely answer. It is all for, oh, by the way, this is for your information. What do I need? I need a letter for the school for this. Are you able to write it? Those are the kind of things that can be done through electronic medical records. You can easily email your doctor safely through an electronic medical record and get the response you need without having to wait 6 months. So it's important to do that after the visit. Make sure that you have access to electronic medical records. Make sure somebody has waived the child signing requirement if your child has a disability. Otherwise, you will be going in there and it'll be a blank page. You need prior authorization to enter your child's medical records. So those are important things to do after the visit.
Very good. So now that we are assuming, I don't think that we should ever assume that the parent is doing this emotional regulation, but I think that should be an ongoing thing where, all right, so I have this and it's going to happen again and again because it's a spiral. So we have the written brief, and then how should we go about prioritizing the tasks? Because I remember when the first diagnosis I got was saying that it was a non-specific developmental something, because back in Rafael now is 21 years old. So they were very cautious of actually giving the diagnosis itself. So, but of course, I wanted to take, I'm a hands-on person. I need to know that I'm doing something. And I did not want to say, oh, you should have this. So, how should we prioritize the tasks? Because there's just so much that we're going to be doing. We're going to have to check follow-ups and get doctors, and we'll look fine for therapy, and then maybe we're going to look for a guru or somebody to help us. Hopefully not a witch to help us, but sometimes it's just so much to do. How should we prioritize? What can you give us some tips of what should we start doing first and next and so forth?
So you see, the prioritization list will be very individualized. It will base on the child's needs. Not everyone is going to get the same list. Not the order in which to do things is going to be different for each child. So if you are getting a long list of things to do from your doctor, again, take a pause and say, do I need to do them in this order? Or can you highlight the 3 things that you want me to do first in order? And then that'll make the doctor take pause and say, I'm giving you all this because I'm not seeing you for 6 months. But let's start with this, then do this. And all the other stuff, it's just resources. So you can access them anytime you want. You don't have to do it all tomorrow. It's hard for me to say how to prioritize because it's going to change with every child's needs. But the person who can help you make that decision is going to be the person who's giving you the list, the doctor. And have them tell you, well, you told me 8 things. Give me the most important 3, and I'll work on the other 5 later. So ideally, they should do that when they're explaining to you. Focus on everything else will come later. But if they have not done that, ask them to do it for you. So you don't have to figure it out because you don't know.
Right. And then we can focus on things that are important, and we'll leave the urgent part aside. And
Right.
all right, so ask them. Very good. So then not every doctor needs we're going to start looking at different fields and obviously trying to find the resources. But then to schedule follow-ups, how do we encourage the transparency and open communication with our doctor and regarding our child?
So I'm struggling. Tell me the question again.
I'm sorry,
Yeah.
we need to schedule follow-ups.
Mhm.
And so it's very important that we are open, right? With, be transparent that this is what we need. So how should we go about that? How should we schedule the follow-ups and make sure that the doctors know that we accept and we do need help? That's what.
Right. And that is something, again, after the visit, we can ask the doctor, are you planning for a follow-up? When will that follow-up be? What are you trying to accomplish during that follow-up? What do you need me to do before that? What do you need from me? Or do I just show up with my child? Asking those questions will make it clear for you as to when, how, what will be discussed, so you can be prepared for it, okay? If the doctor is not planning for a follow-up, but you feel like you need a follow-up for your child, maybe because you think that you may not be able to do everything on your own, you need help, etc., ask them for a follow-up. Say, would you mind if we meet once and just go over some of the things that you have told me to do. Do you have a patient navigator or a parent navigator? If you don't want to meet with me, does your office have a parent navigator or a resource person or a nurse who I can check in with, who can help me guide, and if need be, then they can schedule a follow-up with you. So most doctors' offices will have nurses who will triage phone calls, or a nurse who will be like the go-to person. So get to know that go-to persons, go by, say hello, and so I have a child with special needs. Please don't mind if I call you again for something. I am new at this. I am learning. I need help. And get to know that person. So if the doctor says, well, I don't need to see you, but you're going to see all the other people. However, I have this person you can call if you have questions. While you're walking out, just say, could I meet that person? Can I see the picture of, if they're not there in the office, can I see their picture so I know who they are? And just establish that relationship with that person, because they will be your go-to whenever you have a question about something, or if you're emailing the doctor. And if that person feels that you actually needs to come in about 6 months or 8 months, they will help you schedule that appointment too.
Wonderful. So you did mention about giving us some examples. Sometimes, obviously, you and I are both talking from experience. Mostly you, of course. I only have one, and you, well, and the parents that I have had the pleasure to help along the time. But could you maybe share 3 things that would be to do and what not to do, and maybe give us an example?
Yes. So I will give you an example first because it's fresh in my mind. About 2 weeks ago, we had a family coming from the Tri-Cities area. They needed an interpreter. And when we are seeing families for the first time, we know what the medical record says. We don't know the background of what's happening in their homes or what is life like for them at this given moment, right? So mom came alone with the child. They had filled out the paperwork that we require. So we have a baseline going in. It was filled out by the child's sister, and it was minimally filled out, just yes or no. And then when I looked at it, it wasn't making sense. So it told me that either the parent doesn't understand the questions, or whoever's filling it out didn't understand the questions, or that maybe they have a learning problem. So reading is hard or writing is hard for them. So that's how I walked into the room. And when I walked into the room, I learned that parents are in the process of separating. This mother has 2 other children. One of them has severe ADHD, and the other one is also developmentally challenged and has not had a formal evaluation. And she was here with the 3rd child with the question of autism. And you could sense that it was difficult for her. You could sense that she was struggling. So we got through the history with the interpreter, and I learned through the process that she pursued the diagnosis of ADHD for her son, who's older, and she was managing single-handedly because her spouse was in a different city at that time. And it was really challenging for her to figure out the resources with the language barrier, and also with just being alone in managing everything. So she had a traumatic experience with that. We went in, we did our evaluation of the child that we were seeing, and the child was found to have autism based on 3 different parameters that we need. And I go in there and said, it looks like your child would will be given the diagnosis of autism. And this poor mother, she could not stop crying. She was sobbing, she was crying. And it was hard for us, and it was really hard for her. And she kept she kept repeating, I was alone when my son was diagnosed, and it was really hard for me, and I'm alone right now. And I think it was a replay for her, feeling alone and lost. And it was clearly overwhelming for her. So we as a team took a pause and we said, you know what, go home, drive safe. That's more important than anything that we're going to tell you today. We are going to schedule another visit. We would like for you to have a friend. She said no spouse because they were separating and the spouse had been uninvolved for a long time. Can you please have a friend who also maybe speaks English so that they can be your second set of eyes and ears in case if you start feeling overwhelmed? And she was truly appreciative of that. They left that day. We met with them about 3 weeks afterwards. And it was a very different parent we got on telehealth. She had a pen, a notepad, a paper. She was ready. She was taking notes. She was like, got this, I can do this. So from this is too much and how will I do this? To got this, I can do this. It took 3 weeks. And sometimes it takes more. But it's important to recognize that.
So, again, you're throwing darts at me, but obviously it's similar. I had to be separated myself. And unfortunately, reading just the statistics, which is just numbers, it is 26% of marriages break and with autism. And I think that is very important. And I'm glad you mentioned this because it is the doctors see this, but we need to mention that is not the children's fault. It's the immaturity that the parents, be it the father or the mother, the parents have, that they're not ready to face challenges like that as a team. And unfortunately, it happens too often. So I think that that example is very. I have to compose myself. Give me 1 second.
Take a water break too.
Wow. Yes, because it is part of all the, we don't, like you said, you just read a piece of paper, but you don't know what is happening in the house. And unfortunately, happens more often than we would like to recognize. So, yes. What about something how can we share this? Give me a second. I'm composing myself. I gotta say, things still, it's always good to relive it so we remember and we are vulnerable because this is why I'm doing this. Because if I had someone like you and someone tell me what you're telling me today, I think my road would have been a little more easier. So thank you so much. Is
And
there
thank you for
any?
doing what you're doing.
Yes, I mean, yes, if you know what they say, if I knew then what I know now. But you know what also we're facing? Something that is just when I thought I knew all the questions, somebody has changed the answers. Or no, just when I knew all the answers, somebody has changed the questions. So it's always new, something always happening. So is there anything you would like to add to this?
So I think I got digressed by giving you the example, what you were asking me. What are the things not to do for doctor's visits?
Yes, please.
I think the top on my list is please don't be late. You have a child with special needs, anticipate that they're going to take more time. Anticipate there may be tantrums before leaving or in the car. You may need to stop the car. There may need to be bathroom breaks. There may need to be things. Just plan ahead, plan an extra 30 minutes. Because when you arrive late, you are frazzled. And when you're coming late, the staff is and the doctor is frazzled because they are worried that all the other patients will be late now. And your face-to-face time with the doctor gets cut short. So you're not getting the most out of your visit. Now, I understand that we can plan for everything and still things go sideways, especially when we have children with developmental and behavioral difficulties. But leaving that margin of time, plan like you're going to catch an airplane. Okay, it's going to leave without you. So we wake up 30 minutes earlier and we plan for it. And if we are early, we wait. But if we can get there in time, we won't miss the plane. It's literally that important because that will set the tone for the visit. The second thing that I will tell you, and I will remember this from one of the experiences when I was at a different location, I was at the Children's Hospital. This was a new visit. for developmental delays, and the child had multiple on the consult it had said multiple other medical issues and possible genetic disorder, and they had seen about 15 different specialists, and that's all I knew from medical records. And this parent walks in literally with a carry-on suitcase size bag, and I thought maybe the child's they have the toys and things like that. And they open the bag, Elvia, and it's full of medical records. And they're giving it to me during the visit. And I remember, you talk of overwhelmed. I was like, oh my God. In that moment, do you really expect me to look at all this right now in the time that we have to talk? And I had to compose myself and say, I'm going to call my medical assistant. She's going to make copies of each and every one. It was about a lot, 5 folders full.
Wow.
And that was, I would say that's a not to do thing. Pick what's important, ask ahead what you need, and don't bring a suitcase full of medical records, because we also are humans and it takes time to go through what is relevant. You as a parent know or may not know. And you can, after the visit, go through with the nurse and say, what do you think the doctor will need? And they can come speak with the doctor and say, okay, what notes do you really need? Well, I can tell them I need neurology, I need this evaluation because I've read the medical records. I don't have XYZ, and out of those 8 file folders, I might have just needed 10 pages.
Wow.
So that's one of the things. So if she sent it ahead of time, we would have had time to look through them and decide what was important for us. But in that moment, it is really hard to do. None of the doctor's offices have an army of people to organize things for them. It is as the visit, and we get maybe 10 minutes before the visit to look at stuff. So it's important to be respectful of the time that you have so that it is served for you, not doing something like looking at medical records.
Maybe they just wanted to impress you and say, like, look, this is how well I take care of my child. Wow. Yeah, that's
So,
a definitely big no-no. But good to know, because either are you going to read or listen to them, right?
yes. And everything else that we've talked about, I'll just summarize. Know that it's a partnership. Know that you are as important as the doctor in the room, as the parent of that child. Ask for what your child needs. The staff will appreciate it because it makes their life easier. Bring what you need for your child because they may not have it. And your child only drinks juice from this particular company and will not accept any other drink but is thirsty. Anticipate. We can prevent a lot of behavioral meltdowns by being prepared, by preparing the child, by being prepared ourselves, by carrying all the things that we need, and having that extra person to walk that child out of the office once the exam is done so you can focus. So all of those things are important, and I want to empower parents into taking their power back. You don't have to just sit and listen and say, oh, yes, I will do this and I need to do this. If you don't understand something, and all of our baseline knowledge is going to be different. And the doctor doesn't have magic powers to understand that they are speaking. Is it being understood by you or not? Right? If we keep just saying, yes, I will read and I'll figure it out later, and then you figure it out or don't figure it out, and the thing doesn't get done, then it's not serving anybody.
We're just embarrassed to ask.
Yes. So don't be embarrassed to ask and say, hey, this is a lot. Let's take, you said this at that time. What does this mean? You said to do this. Do you really want me to do this? Or is this how I'm understanding? Just take that pause. It's just mindful listening. And it needs to be for both the doctor and the parent. So you claim some of your power that you have, because it's going to serve you well. It's going to serve your child well if you do that. That's all I would say. You're not powerless as the parent of a child. You are the most important person in their life. You are the one who's going to make things happen.
So, thank goodness we have people like you and so many other, I like to call angels, that just come around. And I want to take about the example that you gave, thank you for sharing. how, yes, she was just overwhelmed and all that. And then 3 weeks back, she's ready. I like phrases, and one of them says, it doesn't get easier, but you do get tougher. So that's exactly what, I mean, obviously she knew that her task was going to be difficult, but she just got tougher. And that's how we do it. We become more resilient and more resilient little by little. So because it's something that we have to do, and we can, other people have done it, and they have been successful. So we just have to learn from those people. And with people like you to help along the way makes a whole world of difference. So thank you so much for.
Thank you, Elvia. This was wonderful. I don't think that some of the things I talked about are taught in medical school. And a lot of people, if we as parents don't take ownership and teach our doctors how to treat our children, then we are failing ourselves and our children.
Right.
So we have to be the ones to teach them if they have not had experience. Be assertive and ask for it. Ask for whatever it is you need.
Wow. I'm just going like this, thinking, but thank you for touching those fibers, because if you touched mine, I'm sure that you will have others. So remember, it doesn't get easier, but we do get tougher.
Yes.
So thank you so much for your time
Thank you,
today.
Elvia.
I'm going to close here.
Okay.
Thank you for taking the time to listen to this. I hope it was helpful. Helped me, even though I am a parent with a son with 21-year-old, still helped me with those tips. And it helped me recognize the importance and validation of my own feelings. My emotions are important, and they affect my family as a whole, and especially my child. I am going to take the liberty of reading what Dr. Gupta writes on her resume of how she describes her practice, so that you can see who she really is. So please, she says, I believe all children deserve to be evaluated and treated in comprehensive and compassionate medical home environment. I practice holistic medical approach, where treatment of children is done in partnership with their family and their cultural belief system within the context of their home and community environment. I provide evidence-driven medical practice excellence, utilizing community-based support systems and resources in collaborative partnership with medical providers for the patient. And she closes, says, I am a partner and an advocate for families of children with chronic health conditions and developmental disability. She's our partner. As I was listening to her, it touched me. She did touch me, because obviously we make honest mistakes as we go visit, because it's ignorance and lack of empathy, oftentimes, of their practitioners themselves. And I hope that many medical providers listen to this again, because it is overwhelming for the parents, and we need to take charge. So an example that she gave of this mother that was just overwhelmed, but she realized that it didn't get easier, but she did get tougher. And that was important. 3 weeks in, then she's okay, I'm ready, because love is just a wonderful motor, and our children deserve it. So I really want to thank you. And please remember, please share this information with families, but also with doctors, so that they know and can hear someone who practices this holistic approach. And I want to thank you. Please remember, you are not alone. God loves you. I'm going to be praying for you. And I ask you to please pray for me, so we continue giving this kind of content. Thank you so much, and God bless you. Thank you.